Hi everyone, I am Lakshmi Priya. I work as a genetic counselor. Today, I am going to talk about pedigree drawing. The aim of this video is to help beginners in genetics, genetic counseling, and other healthcare professionals dealing with genetic disorders in drawing a pedigree. In the field of clinical genetics, family history is an important diagnostic tool which helps in guiding decisions about genetic testing for the patient and family members. If a family is affected by a genetic disease, an accurate family history will be important to establish the pattern of inheritance of the disease. So now, how can you record a family history? One can record a family history in several ways, including charts, checklists, forms, and by drawing a family tree, so-called pedigree. Pedigree is the most preferred method of collecting family history because it can be drawn more quickly than the information that can be written and the patterns of inheritance can be drawn easily. What is a pedigree? A medical pedigree is a graphic representation of family's health history and genetic relationship using standardized symbols. Before learning about the symbols of the pedigree, it is important to know the meaning of certain terminologies used while analyzing the pedigree. So, who is a proband? A proband is a member through whom the family with a genetic disorder is first brought to the attention of the geneticist and if he or she is affected with a genetic disorder. A proband is also called as a propositus or an index case. Who is a consultant? Consultant is a person who brings the family to the attention of the geneticist or a genetic counselor. We will now move on to the symbols used in drawing a pedigree. Symbols used in drawing the pedigree. Square represents male. Circle represents female. Diamond represents gender unknown. If the square or circle is empty, it means that the individual is not affected with any genetic disease. If the square or circle or diamond is shaded or colored, it represents that he or she is affected with genetic disease. If the symbol is shaded with two or more colors or two or more shades, it represents that he or she is affected with two or more genetic disease. The unique fill pattern should be explained in the legend below the symbol. Just for representing multiple number of individuals. If there are 5 male siblings for an individual, it is represented with square and the number has to be written within the square. So if there are 5 male siblings for an individual, it is represented with square and the number is written within the square. If there are 5 female siblings for an individual, it is represented as a circle and the number is written within the circle. If the number of males are many and the number is not known, it is represented with letter N inside the symbol. A deceased individual is represented with a cross line on the symbol along with the alphabet T and age at death has to be written below the symbol. Stillbirth is represented with cross line on the symbol with the legend SB stands for stillbirth and appropriate gestational age has to be written below the symbol. Symbols to denote transgender individuals. In the first row, first symbol is for boy, which is a square. Second symbol is the square with annotation AFAB, which means he is a male who is assigned to be female at birth. Third symbol is a square with annotation UAAB, which means he is a male who is not assigned any gender at birth. In the second row, the first symbol is used to represent a female with annotation AMAB, which means she is a female who is identified as male at birth. Second symbol is used to represent normal female. Third symbol is for a female who is not assigned any gender at birth. So now, whom do you call a non-binary or gender diverse? A person who does not identify as either only male or only female, but instead identifies as something between or outside these identities. Such individuals are represented with a diamond with annotations as how they are identified at birth. Annotation below the symbol is very important as it explains in distinguishing between gender unknown and transgender individuals. Symbols to indicate carriers of genetic disorders. According to the recent guidelines, it recommends that the dot should no longer be used to indicate carrier status. Instead, it is recommended that the symbol should be divided, however many sections as necessary. A unique fill pattern is used to indicate the different carrier results in case he or she is a carrier for more than one disease. As with all pedigree symbols, the fill pattern should be explained below the legend. One example is the symbol of someone who is a carrier of a single hexapathogenic variant and a single CFTR pathogenic variant would be divided in half, and a horizontal line fill could be used for left half of the symbol and vertical line fill could be used for right half of the symbol. To represent pregnancy. If the gender is known, it is represented with square for male or circle for female with alphabet P within the symbol. Last menstrual date along with the gestational age has to be written below the symbol. In country like India, where fetal sex determination is illegal, a diamond symbol along with the alphabet P in the symbol is used to represent pregnancy. Symbols to represent proband. A shaded or colored square along with the arrow mark and alphabet P below the symbol is used to represent male proband. A shaded or colored circle along with the arrow mark and alphabet P below the symbol is used to represent female proband. A square or circle with only arrow mark is used to represent consultants. Symbols for abortion. Triangle is the symbol used to represent abortion. Appropriate gestational age has to be written below the symbol, and also genetic disease if known has to be written below the symbol. A triangle with a cross is used to indicate medical termination of the pregnancy. To indicate relationship, a horizontal line connecting male and female represents mating. This line is also called as the relationship line. Two cross line between the relationship line indicates that the relationship no longer exists. Two lines connecting male and female represents consanguineous union. A vertical line drawn from the line of relationship is the line of descent, which is used to represent offsprings. If the biological parents are unknown, the question mark is used. For monozygotic twins, a single ship line is divided into two and it's connected. For dizygotic twins, a single ship line is divided into two and it's not connected. If the zygosity is not known, then the question mark is used. Assisted reproduction. First pedigree is for assisted reproduction using sperm donation. The wife is pregnant with donor sperm. D is the alphabet used to represent donors. Second pregnancy explains that a couple are pregnant with donor egg. Symbols for surrogacy. In the third pedigree, the couple are pregnant by surrogacy with their own gametes. Alphabet S indicates surrogacy. Last pedigree represents surrogacy with ovum donation. Infertility and adoption. First pedigree represents couple with no children by choice. A single horizontal line from line of descent represents no children by choice. Two horizontal lines from line of descent represents infertility. Third pedigree is for adoption. Interrupted ship line represents adoption into the family, and the solid ship line represents adoption out. Brackets are used to represent all adoptions. Third pedigree is for adoption within the relative. Now we will move on to the general guidelines used in drawing a good pedigree. It is helpful to start drawing the pedigree in the middle of the page. Male partners are always to the left of female partners. Siblings are drawn from oldest to youngest, with oldest on the left and youngest on the right. Here is an example for a pedigree. Mr. X is married to Miss Y. Mr. X has a sister who is affected with sickle cell anemia and an unaffected sibling. Miss Y has three siblings. Mr. X and Miss Y had a spontaneous abortion followed by a male child who is affected with sickle cell anemia, and currently there is an ongoing pregnancy. Date of birth and age of all individuals has to be written in the pedigree below the symbols. Each generation is represented with Roman numerals and individuals in each generation are represented with numbers. There should be a key legend to shading of symbols. Key should contain all the information relevant to interpretation of pedigree. Date of obtaining the pedigree has to be written in the paper. So friends, that's all I have about the symbols of pedigrees. In my next videos, I will be talking about representation of consanguineous marriage and about different inheritance patterns. Thank you.